Modern medicine, for all the advances that have been made, still does not completely understand what triggers the process of labor in humans. Many people are aware of different natural techniques to induce labor, and there are many things that your provider can review with you prior to booking an induction. Your cervix is given a score. We call this the Bishop score. This tells us things about your cervix, including how dilated it is, how thinned out or effaced it is, how soft it is, as well as the position of the cervix within the vagina, if it tips back or to the front, and also the station of the baby, how high or low the head is. All of this, along with your specific situation and desires, matters when deciding on the correct intervention. We do try to practice evidence-based medicine, but we also want you to feel you can trust your body. In general, your cervical exam will determine if you need what we call cervical ripening. Sometimes your cervix is ready for labor already, and you can skip this part. Often, especially for first-time births, the cervix needs a little help getting ready for labor. We call this cervical ripening. It's often the longest and least predictable part of the process. Some offices can perform cervical ripening as an outpatient, meaning that you can either have it done in the office or in the triage area of the hospital, not in a labor room. This is more like a visit rather than the admission, and it's scheduled separately from the inpatient induction appointment. This allows you to leave after a period of monitoring to your home. For most people, it's safe and preferable to be outside of the hospital during the early part of labor. At times, this can take several days, allowing the body to naturally respond to each intervention to see if spontaneous labor starts. Some patients may not be able to have outpatient ripening, and the cervical ripening needs to be done in the hospital at the same time as the induction. This means the patient's not able to leave, but you can still move about. Cervical ripening is generally divided into mechanical and medical options. Mechanical options are devices that can be placed into the opening of your cervix to apply pressure to the cervix. It might include a balloon device attached to a flexible tube to allow water to be inserted to inflate it. So let's see. Well, that's kind of how much it inflates. This can remain in place either until it falls out like a small tampon, your water breaks, or the provider removes it within 6 to 12 hours. If you have a balloon as an outpatient, sometimes you can remove it yourself by cutting it and allowing the water to flow out, and it'll gently slip out. Other options for mechanical stretching include a dilator type of device which absorbs water like a tampon and slowly expands. These look like small skinny tubes about the width of a pencil, but once in place they expand to many times their size. Usually several are placed into the cervical canal by your provider with a speculum like a pap smear. These are left in place until the provider removes them, usually within 12 to 24 hours or if your water breaks. If they fall out at home, we recommend placing them in a small baggie so that we can count them when you arrive at the hospital. Medical options for cervical ripening involve prostaglandins, which are naturally found in the uterus and play a role in labor. There are several biochemical or man-made options, but the goal is the same: to soften your cervix and try to stimulate natural contractions. They can be given as a pill by mouth or placed in your vagina, but all do require monitoring for a designated period of time. And then they can be repeated several times over the course of the ripening process over several days. If you're having cervical ripening in the outpatient setting, we only allow one type of intervention at a time. However, for those having ripening in the hospital, studies have shown that combining interventions is the best approach. So if you're in the hospital and need ripening, we prefer to do both a mechanical option combined with a medication.